So I work in a community mental health team, and we cover the whole of the borough of Westminster, so it's a really big patch. There's about 25 of us working in the team, and we at any one time will be working with usually about 400 people in the community. So like I said, it's a CMHT, community mental health team, so we spend most of our time visiting people where they live, where they are, so whether that be in their own homes or whether it's in care homes, we spend a lot of time working there as well. And we work with a really wide range of different problems. So we spend a lot of our time working with people with dementia, for example, but also we'll help people with problems such as depression or schizophrenia, personality disorders. So it really covers the whole range of mental illnesses that we work with. There's definitely no typical day. It's always very, very different. There'll always be a clinical component to the day, and that will usually be some kind of team meeting. So we might be talking about a new assessment that someone in the team has done, or once a week we'll tend to get together and discuss really complex cases, because often we find with our work it's very difficult to carry a lot of the stuff by yourself, and you really need input from all the different people in the team to come to some sort of decision. So we do a lot of clinical stuff in that respect. I will see patients, but not as many as I wish I could sometimes, because I suppose I'm a consultant in the true sense of the words, that I will often consult with the other staff and really offer them advice on how to manage difficult cases, I think. I spend a lot of time teaching and training, so a lot of my day will be taken up with supervision of trainees or training medical students or other staff members. And then I might be doing things like going out on a mental health act assessment, for example, so what people commonly know as sectioning. I might have to go out and decide if someone needs to be detained in hospital, so that can be quite challenging sometimes. So it's a really, really wide range. I also do quite a lot of management stuff as well, which at first I thought sounded as dull as dishwater, but actually that can be really quite exciting and rewarding itself. Lots of people. Like I said, it's a big team, about 25 of us. There's doctors, so I lead the team, but I'm supported by trainees and some specialty doctors as well. We have psychology colleagues, which really bring a nice kind of different aspect to the work, and nurses. We have occupational therapists, social workers, support workers, administrators. It's really wide. We're truly multi-professional in that sense, which is great. It definitely is, which can feel a bit daunting at times because, as you know, there aren't many more resources coming into the NHS at the moment, but people are definitely getting older. I think by 2050 we'll probably have twice the number of people over the age of 65 that we've got now, so that can be quite a daunting prospect, but equally lots of opportunities and quite exciting. Very, very challenging. But I think the things that make it challenging are the things that make it really rewarding as well. So I've talked about how kind of diverse it can be. Sometimes that can be a bit overwhelming because you're having to shift from doing one thing to something completely different at the drop of a hat. And that can be quite tiring, both physically and emotionally, really. But I'm lucky because the team is hugely strong in terms of pulling together, and we make sure that we're always talking about the difficult things we have to deal with in a very open way, and I think that really helps share some of the load. Someone that likes a good old natter, I think. You have to like talking to people, because whether you're talking to patients, to relatives, to members of the team, to kind of external organisations we work with, you're always talking, and that can get a bit exhausting, but actually that's what you need to do. You need to like talking to people, and you need to like building relationships. I'd say they're the most important things, really. Well, I definitely like a good natter, which doesn't hurt at all. But I think the other thing was, I think when I was training, I felt that older people were being given a bit of a raw deal, particularly in hospitals. It often felt that they were shoved in towards, not really spoken to that much, and just kind of often left there. Maybe it was a perception rather than actually how it is now, I think, because things have changed. But I think what I really wanted to do was talk to them when I was on the wards, and I just found that I would probably spend far more time talking to them than getting on with the things my consultants wanted me to. But it really kind of exploded the world to me in terms of actually being able to form relationships, which I found was as helpful doing that as it was doing the kind of medical interventions that we were doing. I think I can honestly say that there aren't all that many actually, but talking about it being tiring, that is definitely the biggest one. I go home and I am pretty exhausted actually, but usually feel really uplifted at the same time, so it's quite an unusual combination. Paperwork is the bugbear of the modern NHS, unfortunately, and this team's no different. So you have to really be very boundaried with yourself in kind of making sure that doesn't overtake all the clinical work, which is fundamentally what we're here to do, I think. So paperwork and getting utterly shattered by the end of the day, I'd say. It is well paid. I mean, I'm on a consultant salary, which I consider to be pretty well paid. And actually, I get extra sessions in my job now because I've taken on a management role, which was something that I never really anticipated doing. So actually, I get my full-time consultant post, but also I get a bit of additional salary for doing kind of management activities. Well, I think the most important thing to do, because you often don't get much exposure to mental health when you're in your undergraduate years, so I think anyone that's interested in it should really actually go and talk to an old age psychiatrist. So phone up your local friendly old age psychiatrist and ask if you can have a chat with them, or even if you've got time, go and shadow them for a bit, because I think that will really help you understand what the job's all about. The other thing to do is to look at the Royal College of Psychiatrists website, because they're really good at kind of encouraging trainees and students to join them, and you can get lots of discounts and things like that, so that's definitely worth a look as well, I think. I don't think I even really knew that old age psychiatry existed when I was at medical school. I mean, I did a psychiatry placement and I might have done a clinic with an old age psychiatrist, but I think the whole idea of it being a separate specialty kind of passed me by. And it wasn't until I got into psychiatry training that it really became a kind of an obvious option for me, I think. But yeah, it is different. I think when you're at medical school, you see psychiatrists as either a little bit fusty or a little bit eccentric possibly, and actually that's really not the case at all. It's a really, really dynamic specialty. It's really cutting edge in lots of ways in terms of integrated working, which the NHS is moving to. So no, it feels much faster paced and much more kind of rewarding than I think I might have thought it was when I was training. Undoubtedly, I don't think I could do anything else now. I'm a complete convert. I mean, it might be that I might want to move into a different area in a few years, whether that's inpatients or maybe working in liaison psychiatry, which is quite exciting as well. But older people, definitely, I'll never leave that, I don't think.